Hello. Okay, week 8, we have been learning more about ageism and weight and the biases that there are both with age discrimination and with weight discrimination. So, those are two things that when we talk about different types of discrimination, I don't often think about ageism in particular. And even if we look at our material, we've only touched on that briefly compared to weight. I think that's a really important one because, as we found out, ageism is a thing, and there are a lot of biases and assumptions and expectations that are around age. And as a therapist, we just need to be more aware of that and treat everybody. Of course, there's considerations that you have to think about. There's certain stages of life that might present different problems. For example, if you're treating a 20-year-old, they're not going to have the same type of life problems or even history as, let's say, a 70-year-old who's been married for 50 years compared to the 20-year-old who has just been in a relationship for a year. So there's going to be similarities, but there's also going to be differences that need to be recognized, but not to make assumptions and there was a difference too between just the men and women and overall where they felt is in terms of satisfaction with their life given the different aspects of their life. So there was a lot of interesting things there, and definitely some biases that were brought into from therapists. So that was interesting. And then with weight, which the focus was much more on weight in the material this week, and that there was some information in there that I found pretty surprising. That on average 12% of overweight women get paid less than those of average weight. That they select jurors. I think that the term that was written in there was that they said that they tend not to pick overweight or obese jurors because they have that thought that they're lazy and stupid, I think is what it said. And then just the assumptions of what people would be better for certain jobs based off of weight. So I think it was receptionists and people who dealt with the public more directly were less likely to get hired on for positions than those who were of what was considered a normal weight, whereas tech jobs or computer jobs were more assumed to be people who were overweight. And so there's a lot of biases and different implications there as far as that goes. And then looking at just the way that they felt safe in seeking therapy. And I thought it was interesting too. I believe, if I remember correctly, that it said that those who were overweight judged themselves more than other populations. So, and that was they assumed that was from their own biases or their own feelings of lack of self-esteem that came from the society and the different anecdotes from society. And so that was interesting too. So overall, both of these things are important to consider when providing therapy, both to different age groups and both to different body types. And as it was mentioned in there, like it would be important for a therapist when to have as we talked about last week with the LGBTQ community, making sure that there is the right education provided so that you can be confident. That needs to also happen with different body types and to address those biases that might be there. And even if the therapist doesn't feel that they have biases, the client themselves are coming in with with their own biases about how they view themselves. The TED Talks was pretty empowering. I liked how she reframed some of the terms and how she really empowered everybody to be true to themselves and to just be happy. And that would be ideal, but the fact is that a lot of people aren't so welcoming of themselves, and they don't love themselves as much. And so I think as a therapist, it's important to encourage that and to meet the client where they're at and be patient with them and help them to build that self-esteem and that self-worth and that love, and to appreciate who they are and all of the strengths and characteristics that they have, and help them to see themselves as beautiful just the way that they are. But that can take, that requires taking down these like she mentioned, the labels that society has put on to them and that they have put onto themselves. And so taking away those labels and helping them to kind of restructure their perspective of themselves is important. And also to be aware of biases that we may come in. We might suggest certain things, or I kind of think about it when we were looking back at race and there was micro expressions. I feel like that could possibly come up when you look at age or when you look at weight. You might not realize that you're being offensive with something that you're saying or suggesting, and in fact you're just further creating a bias or reassuring a negative viewpoint that they may have had. So it's just important to understand your own biases going into that, and to make sure that you are competent and aware of where you stand, but also where the client might be at with their own feelings. So, yeah, thank you.